Hi, I'm Dr. Tom Geary. I'm a general internal medicine physician and I've been in practice for about 30 years. I now work with the Alabama Department of Public Health as a Bureau Director for the licensure and certification section of the department. We do the inspections of licensed healthcare facilities in Alabama, and I want to talk a little bit about Alzheimer's disease and specifically about the evaluation of mental status. There are a number of tests that can be administered to people to determine whether or not there's a possibility that they have a dementing illness such as Alzheimer's disease. As you know, there are over 100 different things that cause dementia, and Alzheimer's is the most common cause of dementia in the United States today. There are a number of tests that have been developed for determining whether or not a person has a potential for dementia. But the point that I want to make is that no one test is absolutely 100% perfect in making a diagnosis of dementia, especially of Alzheimer's disease, and no one test is able to give an accurate assessment of what's coming next in any individual's life. The test that we know most about is called the Mini Mental Status Exam, and this is a quick and easy test that can be administered by a non-professional to help to determine where a person sort of stands in terms of their dementia. But that's not the only one available. There's one called the Montreal Cognitive Assessment Test. There's the St. Louis University examination, mental status examination, and the CMS in the assessment of people in the nursing home uses what's called the BIMS, the brief interview for mental status exam. The Alzheimer's Association has an excellent section that talks about the use of these tests in Alzheimer's disease, and I printed out the page that reviews all of the different tests that they looked at, and it talks about all of the advantages and the limitations of each one of these tests. The main point that everyone needs to remember is that memory and associations with understanding where we are and what's going on are different in every individual, and so no one test can make a diagnosis of dementia. It involves seeing a physician who is interested in this disease states, usually a neurologist or a gerontologist, but internists and family practice doctors, if they have an interest in this disease, can do an excellent job in starting the diagnostic process. We have to know what medicines a person is on because, as I always say, it's always the medication causing problems until proven otherwise. We have to know what other illnesses are going on, what the blood chemistry looks like, and what the brain looks like on imaging before we can actually come up with a firm diagnosis and move forward. There are newer tests coming out all of the time. There are PET scans that can determine exactly the amount of amyloid that's deposited in the brain and can really help in excluding a diagnosis of Alzheimer's disease or proving that a person does have Alzheimer's disease if necessary. So these mini mental status exams are a useful starting point, but they should not be used to make a diagnosis, and they can't be used to predict what's coming next in terms of behavioral problems that might develop with dementia. Many times people will do very well on a mini mental status examination, and yet when you look at how they actually interact with caregivers and family members, how they manage their own affairs, they do terribly. The other side of the coin is true as well. Some people do very poorly on a mini mental status exam, and yet these tests don't tell you anything about what they have retained in terms of their ability to function. There are people who have very poor scores who can still read and who can still sing and who can still quote scripture and provide a great deal of comfort to the people around them. So putting too much reliance on this mini mental status exam in determining a care plan for someone or how to get that person involved in meaningful activities for their lives is problematic. You have to look at the whole person. You have to look at their history, their interests, their abilities, and not just their disabilities that may show up on the mini mental status exam.